When you have facial disproportions, then this can be very easily addressed by what is called as jaw corrective surgeries or orthognathic surgery. Most of the times people come to us asking they have an issue with chewing, their bite is not all right, or they have issues where they have some degree of facial asymmetry, or sometimes you have an issue where the lower jaw is either overdeveloped, that is called as prognathism, or you have the lower jaw underdeveloped, which is called as retrognathism. That means that the jaw is behind. Similarly, even in the upper jaw, you can have a prognathic, that means the upper jaw is very much forward, or it could be very much backwards. In addition to that, this is in a horizontal direction where the growth happens. Sometimes you have an issue with the vertical dimensions. These are the common reasons why people come to us for these kind of orthognathic procedures or jaw joint surgical procedures. What age the surgery can be done? Hello, I am Dr. Girish Rao. Jaw surgery or orthognathic surgery, what we call technically, is a gamut of surgery which we do when somebody's jaws are not proportional. There are a lot of people who are born with certain kind of facial deformities where one side of the face is overdeveloped or underdeveloped, or one of the jaws could be overdeveloped or underdeveloped, or when you smile you can actually show too much of your teeth and gums, which is called as gummy smile. So when you have these kind of facial disproportions, then this can be very easily addressed by what is called as jaw corrective surgeries or orthognathic surgery. Most of the times people come to us asking they have an issue with chewing, their bite is not all right, or they have issues where they have some degree of facial asymmetry, or sometimes you have an issue where the lower jaw is either overdeveloped, that is called as prognathism, or you have the lower jaw underdeveloped, which is called as retrognathism. That means that the jaw is behind. Similarly, even in the upper jaw, you can have a prognathic, that means the upper jaw is very much forward, or it could be very much backwards. In addition to that, this is in a horizontal direction where the growth happens. Sometimes you have an issue with the vertical dimensions. So if you have an excess of growth of the jaws, then you can have an elongated face, or when you smile, because your upper jaw is overdeveloped, you show too much of your teeth or too less amount of teeth, and that is called as gummy smile. When you show too less amount of teeth, you may even look very old. And these are the common reasons why people come to us for these kind of orthognathic procedures or jaw joint surgical procedures. What age the surgery can be done? Normally we wait for the growth to happen. See, what happens is when the facial skeleton and the soft tissues grow, a child basically when it becomes adolescent, usually puberty is between the age of about 11 to about 14. Now that is when there is a huge growth spurt of the face. So we wait for this growth to happen, and generally once the growth is completed, at that point of time we do these kind of orthognathic surgeries. But there are times when the growing face can be molded. So at that point of time we get to see you with our orthodontists who are braces specialists, and we can actually correct your tooth position so that the amount of deformity which you can get is going to be very minimal. So it is important when you have an issue with your growth, or if you are showing too much of teeth because of protrusion, or showing less amount, or there is a bit of asymmetry, then it is important that you come to us. We can assess your problem and then decide when we can do the surgery. But by and large, most of these surgeries are done between the age of about 16 to 20 years of age. But age is just a number. Even if you've finished your growth and if you're a full-fledged adult, we can still do these kind of surgery even in your adult age too. Not an issue at all.